Welcome to the Perfect Dose podcast. We dive into everything you need to know about skincare treatments, wellness tips, and skincare routines so you can look and feel your best. If this sounds like you, make sure you hit subscribe so you can stay up to date on the latest episodes. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. My med spa, The Perfect Dose, is located in Scottsdale, Arizona. If you are interested in becoming a patient and seeing me in practice, make sure you head straight to my website. If you're a medical provider and you want to stay up to date on the latest trends, techniques, have access to my protocols, articles, and business tips, make sure you follow me on Patreon at The Perfect Dose. For everyone else, follow me on Instagram and TikTok at The Perfect Dose. Hi everyone, welcome back. Today, we are going to be breaking down some of summer's most trending treatments according to RealSelf. And you guys know me, I love a trending treatment. However, not everything that is trending is worth the hype. Sometimes I feel like it's worth the hype. Sometimes I don't feel like it's worth the hype. And today's episode is going to break down these summer treatments, and I'm going to tell you guys yes or no. Okay. So first up, the first thing that RealSelf is recommending as the number one trending treatment this summer is clean girl aesthetics. And what that means is less is more, natural is in. So I really love this trend right now. Now, RealSelf broke it down and they wanted to say that baby Botox was in, skin boosters are in, and lip flips are in. So I'm going to tell you guys, baby Botox is an absolute no. Here's why. Botox is based on units, and baby Botox just means less units, which doesn't mean you're going to look more natural. It just means your Botox isn't going to last very long. It also is going to increase your risk of becoming resistant to Botox. And what that means is over time, if you get 20 units every couple months, so this baby Botox trend that they're talking about, what's going to happen is you're going to develop a resistance to the Botox and it's not going to work as well. Eventually, it may not work at all. So instead, what I recommend doing isn't baby Botox. It's going to be full face Botox, just less often. You don't have to get Botox every 3 months. That is a big myth that I want to break. And I tell this to my patients all the time. How often you should get Botox is really dependent on you as long as you are getting the correct amount. So on average, that's going to be about 100 units for full face. And full face actually makes you look more natural. And I always give this example. Imagine if you see somebody walking around and she has no lines on her forehead, but then suddenly you look at her and she has lines by her corners of her mouth, her DAO muscles pulling really hard, or she has really strong neck bands. She's going to look unnatural and older. People are going to be like, Karen, you get Botox because she has a frozen forehead and everything else is moving. So in my opinion, we should do a higher dose, full face Botox, just less often. So typically what I recommend is doing full face Botox once every 4 to 5 months. That is on average. Now, studies will show that in order for Botox to be preventative, you only need to do it twice a year. There's a really cool twin study, and you guys can see here, this is one twin that was treated with Botox twice a year for 13 years, and her other twin was not treated at all. There is a significant difference. So baby Botox is a no. Instead, get more Botox less often. Now, what about skin boosters? Skin boosters are a yes for me. I freaking love skin boosters. Skin is in. Now, there's a couple different skin boosters that I'm going to talk about that are out on the market in the United States today. And the first one is SkinVive. This is going to be a skin hydrator. So it's the only FDA approved skin booster for injectables in the United States. So this is going to be my go-to for anything smile lines around the lips, just overall skin health, because it's not going to add volume. That's the difference between a skin booster and a filler, is fillers are going to add volume. Skin boosters are not. So I don't think anything in this area needs volume. So SkinVive is a yes for me. The other skin boosters that I'm really loving right now, you guys, are polynucleotides, which is salmon sperm. I'm also loving Exosomes, and these are treatments that you can get topically. They're not injected, right now. I'm sure more injectable skin boosters are going to be coming to the market, but right now SkinVive is the only injectable ones. The others are FDA approved for topical use. What that means is we will basically microneedle your skin using some of these skin boosters, whether that is a Mermaid facial. Those are super popular right now. And that's really a combination of many skin boosters that's used to help your skin glow. The quality of your skin will improve based on utilizing these boosters. Another really popular skin booster, like I mentioned, was polynucleotides or salmon sperm. And these are basically just microneedled in to help stimulate collagen. They help with pigment, fine lines, overall skin glow. And another really popular one right now are exosomes. Exosomes basically make your skin cells work better and more efficiently. So I am obsessed with skin boosters. They are an absolute yes for me. I recommend getting these done every quarter. I also recommend doing something like SkinVive 1 to 2 times a year. You really don't need to do it any more than that. However, you can do these skin boosters that I'm recommending quarterly, like microneedling skin boosters. You can do them more often. The more skin boosters you have, the better your skin is going to look and feel. And you guys, there's no surgery that changes your skin. So we have to take care of our skin. Even if you plan on getting a facelift later, you need good skin or your facelift is going to look weird and unnatural. The next thing that RealSelf is recommending in this clean girl aesthetic category is going to be a lip flip. And that is a yes for me. However, it's a yes with an asterisk because lip flips are amazing. What they do is they relax the muscle around your mouth called the orbicularis oris muscle. And this muscle is going to elevate your lip, okay? There's a series of muscles, not just the orbicularis oris. There's also a couple other ones that are levator muscles or lip elevator muscles. And what happens is when we smile, our lip will elevate. So if your gums show when you smile, a lip flip is freaking amazing. It also is going to reduce muscle activity around the mouth, so your lip filler is going to last longer. So I say absolutely yes to lip flip, but you have to understand, and this is why I put an asterisk there, lip flips don't add volume. So you can't get a lip flip instead of lip filler. It's just not going to work. You're going to have 1 to 2 millimeters of more of your lip showing, really just relaxing that muscle. You're not going to get volume. So if you're like, I want bigger lips, I want my lips more hydrated, more defined, you need lip filler, but adding a lip flip on top can help it last longer. Number 2 on RealSelf trending treatments is going to be pro guidance rather than skinfluencers. And I am here for this, you guys. What this means is people are basically searching terms on TikTok right now, like derm experts, nurse practitioners. People are relying on experts rather than influencers to determine their treatments and their skincare. And this is an absolute must. Thank gosh for this trend, you guys, because following your favorite influencer is not always the best way to rely on what treatments you should get, what skincare products you should invest in. A lot of these times, these influencers are getting paid to promote these products, and sometimes they're not even using the products themselves. So very important, before you go buy something that one of your favorite influencers is recommending, you do your research and you ask the expert. So we'll actually tell you, yes, this product is worth the investment, or no, this product is not worth the investment. The next thing that RealSelf is recommending as a trending summer treatment right now, based on celebrity input and what they are seeing all over social media, is something called Rich Girl Face Luxe Look Treatments. And what this means, I mean, what a fancy word, right? What this means is they are recommending Luxe Look treatments like deep plane facelifts, facial balancing, and temple filler. So we're going to break these down. Deep plane facelift. Yes, absolutely. I recommend a deep plane facelift. What that means is we are actually, our plastic surgeon is going to be repositioning the muscle in your face. So they are literally giving you the best facelift ever. They're not just repositioning the skin, but they're actually lifting and putting the muscles back where they go. So this is a must for me. The day I get a facelift, it will absolutely be a deep plane facelift. However, what I want to mention here is I am not a fan of facelifts in your 30s. It's not necessary, you guys. We have so many non-surgical treatments. We have so many alternatives to surgery right now that should not be your go-to number one. I recommend getting a deep plane facelift in your late 40s, 50s, even 60s. This is a more appropriate time, but yes, deep plane facelifts are going to be a yes for me. The next thing they mention in this category is facial balancing with filler. And that is a 100% underline, because we are done with single treatments. And what that means is I literally have patients that come in my office and they'll be like, I want my lips done, but really they're a candidate for chin filler. So instead of focusing on single areas and us being like, yes, let's give you the lip filler that you want, we are now shifting towards a focus of natural and harmonized appearances. So people want to look natural, they want to look balanced, and sometimes they may think they're a candidate for one thing, but really they're a better candidate for the other. So typical areas that we're seeing with facial balancing are going to be in the mid-face area. We're like done injecting the lateral cheek. That's weird. We are also injecting the temples, which is listed on here in its own category, which is huge. So we'll get into that. But we're also seeing people getting treated in their chin for facial balancing, in their jawline, this preauricular space back here where we lose volume over time. So these are areas that are an absolute yes. And the key with facial balancing is minimal filler, okay? We don't need to be looking like a filler face. Less is more. As long as we are getting injected in strategic areas in order to balance and harmonize features, you will look very, very natural. And filler for facial balancing is the only thing that I do in my office. This is number one. Next, they talk about temple filler, which I am like, heck yes for the temples. The temples are a big, significant area of aging in the face. As we age, we lose bone, we lose fat. And what happens is before we were focused on just cheeks and we were getting hollow in the temples, looking like peanut heads. Now we're focusing less on cheeks and more on temple restoration. So think about getting like almost a ponytail facelift, right? Like if we are focusing on filler in the temples, in the preauricular space, baby amounts of filler here, you are going to be getting a lifted appearance. Filler doesn't lift, okay? It adds volume. So the key is adding volume strategically so you look lifted and you look balanced. So temples are a must for me as well. Number 4 on the list is skin cycling goes clinical. You guys, I am here for this trend. What this means is people are now pairing at-home treatments with in-office treatments. So you are not just buying a bunch of skincare at home. You are not just coming into the office and getting all these expensive treatments and then not protecting your investment. We are combining treatments. We are skin cycling between at-home treatments and in-office treatments. So I love this trend. In particular, what they are talking about being trending is laser resurfacing, PRP, and chemical peels. So laser resurfacing, huge fan. What that means is we are basically ablating the top layer of your skin. So think about like taking that first layer off. So improvement with texture, fine lines, wrinkles, pores, pigment, basically everything. And my number one recommendation for laser resurfacing is going to be a CoolPeel. And a CoolPeel is a minimal downtime. So that's huge for the summer, you guys. We want minimal downtime in general. But it is a minimal downtime laser resurfacing treatment that improves everything on the surface of your skin. Now, it can be compared to a traditional CO2, and traditional CO2s are going to be significantly more downtime, lots of swelling. They're typically done at plastic surgeon's office, but most people don't need a full CO2. Having a mini CO2 like a CoolPeel suffices. We do this in my office all the time. I get insane transformations. In my opinion, yes, laser resurfacing. Next, they say PRP. And so I'm going to give this a thumbs up and a thumbs down. Here's why. PRP, platelet-rich plasma, is a form of growth factors and regenerative medicine that relies on your own blood and your own supply of growth factors. If you are 20, I say 100%. PRP is going to work. It's fabulous. It's amazing. I absolutely recommend. If you are in your 30s and 40s, our growth factors are going to decline with time and age. So I'm actually going to recommend doing Exosomes or PDGF, which is basically growth factors that are made in a lab. So we know, yes, these are going to work. I just think that's a better investment if you are older or if you have any lifestyle conditions. Like let's say you're not somebody that drinks a ton of water, you don't eat super healthy all of the time. these things are going to impact your growth factors. So something to consider. It's a great treatment, but if you're older and the quality of your growth factors isn't that great, you may need more treatments. So it could just be a bigger investment. The next thing on the list is chemical peels. And I love a chemical peel, you guys. What I hate is the big medium depth, deep chemical peels. And that's just because I'm not a fan of downtime. If you can handle the downtime of your skin, like flaking and peeling, 100%, go get an aggressive chemical peel. That's where you're going to see the most benefits and results. However, there is a really great chemical peel that's on the market right now, and it's called a BioRePeel. It's a no downtime peel. I'm obsessed. It is a TCA peel, so it's going to penetrate deep into your skin. It's going to help with pores. It's going to help with fine lines, wrinkles, acne, pigment, literally so many things, and you're not going to have the downtime. So I would recommend getting a BioRePeel this summer. PRP, if you're 20, if you're older, think about doing Exosomes or PDGF. And then laser resurfacing, yes, for everyone. I totally recommend, especially the CoolPeel laser, because it's so minimal downtime. If you wear a hat and sunscreen afterwards, you're going to be fine to get this treatment during the summer. Next on the list is hair restoration. They say hair restoration is hot this season, especially Exosomes, TED for hair growth, and stem cell hair treatments. And I am 100% here for this. TED in particular is what I recommend to every single person. So TED hair restoration is Alma TED. And essentially what it does is it uses ultrasound to open up the channels of your hair follicles. So no needles, you guys. It's a game changer. You don't have to get poked a million times in the scalp, which hurts like a freaking mofo. I don't know if you guys have ever had this done. It is extremely painful. This takes the pain all away from hair restoration. And then we infuse exosomes into your hair. So the Almated serum is actually packed with exosomes. And exosomes are like little Amazon Prime packages, okay? And those packages are going to make your hair follicles stronger. They're going to make your hair follicles work better. So your hair is going to be thicker. It's going to grow more. I mean, I'm a huge fan. I did this treatment myself. Here is my side by side, and you can see my hair restoration was next level. This was all within less than a year. So absolutely crazy hair transformation. I'm also going to recommend that you get plaited hair, and plaited hair is the only take-home exosome treatment for hair restoration. So you're going to literally apply the serum on your scalp massage it in, and that's going to be your take home. So skin cycling with in-office and at home, like we talked about on the previous trend, is going to be done with hair restoration as well, because you're going to get a TED treatment in office, and then you're going to go home and use your plated exosomes in order to make sure that your hair restoration lasts. And what's great with this, you guys, is there's also no downtime. So I recommend this procedure. I would say this is going to be moved up to like my number one, just because it is so next level with regenerative medicine and actually causing change at the cellular level. And it actually works. I have not seen anybody not get results from this treatment. So I recommend this 100%. I agree. Hair restoration is hot. And the last thing on here is body tweakments. And I really love this word because it's not just body treatments or body changes, it's body tweakments. So right now we are trending towards doing treatments that are tweaking our body or enhancing our overall outcomes. And the treatments that they're talking about in particular with RealSelf in this Instagram post is Emsculpt, skin tightening, and treatments for cellulite. So let's break this down. Emsculpt, that is going to be a device that helps your body tone muscle. So what I'm going to recommend is similar to Emsculpt. It's called Evolve. And I love Evolve because it uses radio frequency to heat up fat. So your fat's going to melt, your skin's going to tighten, and it's going to be the same as doing 30,000 crunches at once. So who can do that at the gym? No one. It's impossible. So you are basically enhancing your workouts at home by doing treatments like Evolve in office. And that's just going to help you tone, tighten, enhance your results, and get your results faster, which we love. We always want the faster result. So that's a yes for me. Skin tightening, I love. My favorite treatment for skin tightening is going to be Morpheus, and that uses radio frequency, so heat, to tighten the skin, stimulate collagen. It also uses needles that drive that heat down and then also cause physical injury to the skin, so you're getting even more collagen stimulation. I'm obsessed. I love this for areas like the stomach, like the thighs. It also helps break down cellulite. So this is what I recommend for both of these treatments, like skin tightening and cellulite. Get Morpheus. Also, hybridilute Radiesse. And this is a biostimulator that's basically going to stimulate collagen. So your skin's going to be thicker, firmer, bouncier, tighter. So if you pair these together, you will be looking next level good for hot girl summer. So hopefully you guys loved this episode. We broke down all of the trending treatments according to RealSelf for this summer. I pretty much agree with all of them except baby Botox. We're not doing baby Botox. Instead, we're going to full face Botox less often. So we're not going to get Botox 4 times a year. We're going to get it 2 to 3 times a year, higher doses. That's what I'm going to recommend. We're doing lip flips with lip filler, not alone. I definitely agree with this pro guidance. The Rich Girl Face Luxe Look treatments are totally in this year. I don't recommend deep plane facelift when you're young, but 40s, 50s, absolutely. This is going to be a game changer. And I feel like my favorite is hair restoration is hot because it is and it works. So get some plaited hair. I will link it for you here. I'll also throw in a discount code for all of my listeners so you guys can save on this purchase. And consider Alma Ted. I would absolutely find a provider near you, consult for this treatment. It is next level and it doesn't hurt. Okay, that's it for today. I'll see you guys next week.